back, everybody. Hope you enjoyed your lunch, and I hope you enjoyed the beginning part of this SA Healthcare Summit 2022 that's been brought to you by Afrocentric, South Africa's most extensive, diversified, and seamlessly integrated health company. I think that some of the topics that have been discussed have been very, very vital to South Africa and healthcare. Healthcare, probably one of the biggest issues that affects South Africa. Adequate healthcare. How do we get to a point where everybody has access to good healthcare? Even those of us that are in the very fortunate position of being on a medical aid, we are paying so much money to access this healthcare. And those that are unable to get the private medical healthcare, what kind of condition do they walk into when they are not well? Well, we know that some of the stories haven't been good, but we've highlighted the gaps that need to be fixed, and we now need to fix them. The COVID-19 pandemic really shone a spotlight on our healthcare sector here in South Africa, and the idea is to learn from it and better it. And I think that's what I've been gathering from all of the experts that we've got here. There is the capabilities, there are the skills to do this. We need the will, and that is where we're at right now. So somebody that could help us get to the bottom of this, and somebody that we need on our side when it comes to fixing up the healthcare system, is the man in charge of healthcare in the country. We're very lucky and fortunate that the Minister of Health managed to send us a pre-recorded message for this summit, and it is my absolute pleasure to introduce him to you. Of course, you know him, Minister Joe Phaahla.
Thank you very much, Program Director, Ms. Leanne Manas, and also Ahmed Bandekra, the Chairperson of Afrocentric, Dr. Anna Mokgokong, the esteemed speakers, participants, guests, and ladies and gentlemen. It's very grateful for me to really be part of this, to speak to this summit, the 2022 Healthcare Summit. And let me congratulate Afrocentric for hosting this summit. And as we are reflecting on the impact of COVID-19 pandemic, the past 2 years have been very difficult, characterized by all this various waves of this pandemic. In the beginning, we thought it was just going to be one sweep of this, and then we'll be done with after a number of lockdowns and other restrictions. But unknown to us, as we thought we're out of it, another wave came, and the rest is history, as we now know. Currently, in the global context, we have observed a consistent reduction in the number of cases of COVID-19 as reported on a weekly basis. And also during the course of January especially, including here in South Africa, where we are just emerging from the fourth wave of this pandemic, which have been driven by the Omicron variant. The last few weeks have been quite a drastic, seen quite a drastic reduction. Over the time, we have moved even also in the positivity rate, which indicate the extent to which the virus is prevalent in the society. We have moved from the heights of up to 37% early in December and towards the middle of December to where we are today in the last 7 days on the average of just over 5% of positivity rate. Today, we have just recorded just a little under 5% on the 21st of March on Human Rights Day. We just recorded a 4.8% positivity rate, so which is quite encouraging that we are indeed on a very positive downward trend of the infection. We could not have achieved the stability which we are now entering into, and which we have seen even over this fourth wave of driven by the Omicron, even though with a high transmissibility, but with limited or reduced hospitalization and reduced deaths. We appreciate the fact that we're on a downward trend, although clearly we would have preferred that no one should die from this virus. But the reality is that it is still with us. Many countries have acknowledged that good health is an indispensable prerequisite in the elimination of poverty, in the growth of the economy, and generally in improving socio-economic conditions of people. We also recognize that health is an important goal in us ever being able to attain our sustainable development goals. So we believe your summit should contribute towards the process of examining and implementing the strategies for a future that is based on a very resilient and sustainable national health system, which will help us to attain also the overall sustainable development goals, which we have all committed to achieve by the year 2030. South Africa has embarked on a journey to transform our health system into one which can realize the objective of our mission, which is a long and healthy life for all South Africans. And we have opted to achieve this through the implementation of the National Health Insurance as our strategy to move the country towards what has been defined as the universal health coverage by the United Nations and the World Health Community under the World Health Organization. The implementation of this national health insurance in achieving universal health coverage is aimed at transforming the current inequalities and inequities of the health system into a system which will deliver quality health care for all South Africans, irrespective of their level of income, whether they are employed or whether they are unemployed. So that's what we are thriving and I mean we're aiming to achieve through the National Health Insurance. To all our honored guests, I've also been asked to talk about how the public and private sector can deepen partnerships in order to transform our health system, taking into account the challenges and the lessons which we have learned as we have been traversing this COVID-19 pandemic, and to see in the context of this summit what are the lessons which we can learn as you ponder over the theme of your summit, which is reimagining well care, which I find very appropriate, that it is a good opportunity to explore how we can move our society towards a very healthy society, a happy society, hopefully very prosperous, and where everybody recognizes very good well-being. So as we reimagine what is possible, there have to be successful partnerships and collaborations between the state, the government, and also the private sector, the private industry. And I've said already that while we have gone through difficult hardships of lockdowns, but with what we have achieved, where we are now with a bit of stability, we couldn't have done that without partnership between government and the private sector. Now, I will just allude to a few of those areas which we can highlight as the high points in terms of this partnership as we have been traversing this COVID-19 pandemic. Some of those, just to highlight a few, is that we have achieved this through contracting private providers, such as private practitioners and private hospitals in the provision of clinical services. We have shared a lot of facilities right from the first wave of the COVID-19 in the early part of 2020, and we have been building this relationship over the last 4 waves. Some of the challenges which are identified in this area were in terms of contract management and the determination of tariffs for the purposes of reimbursing the private providers when we have used private health facilities for uninsured members of the population. So this is a work in progress. We have gone through trial and error in terms of arriving at agreements in this regard in terms of reimbursement tariffs for the uninsured members of the population. Secondly, we have been sharing resources in the provision of diagnostic services in very good collaboration, I must say, between the National Health Laboratory Service, which is our overarching provider of laboratory services in the public sector, with a wide range of private laboratory groups to ensure that the requisite diagnostic processes are undertaken timeously. But not only that, but we've also shared the results of this test, and that is why our National Institute of Communicable Diseases can, on a daily basis, provide us with up-to-date information on a daily basis in terms of how the pandemic has been moving, the number of tests performed almost, on time. The number of tests performed, the positivity rates, and all that, it's been very successful. Sharing of data to ensure that available beds are utilized optimally through the development of what we call a bed bureau, which on a regular basis, especially when bed capacity became very tight, both in terms of general wards, high care, and ICU. So this sharing of information has been very handy. Provision of healthcare services through streamlined clinical guidelines. We have been sharing the clinical guidelines to make sure that there are protocols in terms of clinical care for the COVID. Digital streamlining through reporting both for the public and also for the private sector, hospital admissions through the DATCOV systems. So through this, almost real time, we know what are the beds available in the public sector, also in the private sector. The utilization, when we now embarked on the vaccination, the utilization of the electronic vaccination data system, EVDS, which is now the overriding system through which we record all our vaccinations, irrespective of whether you vaccinate in the public sector or in the private sector. So this has given us the ability to collate all the information, reconcile at the close of every vaccination time per day. We're able to receive real-time information on the vaccination data because we're using one single data system, both in the public and private sector. The COVID-19 vaccination program presented the most successful partnership where the private sector and the public providers, we're sharing a platform in terms of the vaccination. Also, irrespective of whether a person has got a medical scheme, is insured or not insured, they can vaccinate either way in the public or in the private sector. And this has been a major achievement. The process of vaccine procurement, where the state has been the main procurer for both the public and private, but making sure that the vaccines are available and can be accessed both on the public and private platform. I know that some of the private sector role players were a bit apprehensive in the beginning, but I think finally this has worked very well. The establishment of a no-fault scheme, which is in the final stages of actually being fine-tuned, and this scheme is to look after where people may experience serious adverse effects following immunization. Now, this cover, in the case where there is such serious adverse effects, covers whether you have been vaccinated in the public or in the private sector. The other area, as part of strengthening of our domestic capacities, South Africa is participating at various forums to improve access to equitable access to vaccines, working through multilateral bodies such as the World Health Organization, but also in terms of going forward, also in terms of sharing the mRNA technology, in terms of and we're very happy that WHO chose amongst a number of countries, in about 6 countries in the continent. South Africa was one of those which have been chosen to develop an mRNA hub. And we're very happy because this technology is not only to enable us to develop vaccines for COVID, but also we believe that we're informed that with this technology, even other vaccines which have been eluding us, like your HIV vaccine, possibly TB, malaria. So a lot of other possibilities once we can be able to have access to this technology. There are lessons that we can learn from during this COVID pandemic, challenges and opportunities which we can put to good use from the number of collaborations which we have had between the public and private sector during this COVID-19 pandemic, amongst others on the GP contracting, which is an area which we have not done very well during the last couple of years when we've been running some pilot programs on the national health insurance. We have learned that the GP contracting cannot happen in a vacuum, and it requires to be a part and parcel of a comprehensive health service plan. And this is one of the lessons we have learned. We have also learned that the procurement and contracting of specialist services should be through using global tariffs mechanisms as a preferred route for managing these contracts so that it can be more comprehensively managed. We have also learned that the costing of a private hospital bed, day, and individual services can be quite complex and involves complex costs and sometimes very difficult to can actually quantify these costs. And as a result of this, we have seen a situation where especially our private providers then retreat to the existing tariffs, because in trying to work on really, the cost incurred has become quite a difficult exercise. Now, the pandemic has also highlighted the necessity for partnerships, not only to help the country to rapidly improve in delivering of services and finding solutions for the most pressing problems, but also to ensure continuity of essential services, despite the challenges which has been presented to us by the COVID pandemic. For the government, making the most of these partnerships remain a critical part of our agenda if we are to deliver the best possible good quality services for all our population. We would want to learn from the experiences of COVID-19 pandemic so that we can be able to provide good quality healthcare. And we also want to emphasize from the lessons we learned through this pandemic that we would want to urge various role players to indeed, accept the norm that health services should not be viewed, the spending in health services should not be viewed simply as a consumption, consumption expenditure, but should be looked upon as a major investment, not only in terms of this improvement of quality of life socially, but also we believe that for economic, stability and growth. We have seen how a disease in the form of a viral infection can be so disruptive, not only to social life, but also to economic life. So we believe that a major lesson for all of us, both in the public and private sector, is that investing in good quality health systems is not just good for social life, but is also good for the growth of our economy. One of the key interventions that the country has embarked upon towards the end of 2018 was that our newly elected president at the time, President Ramaphosa, convened a presidential health summit. And arising out of that health summit, a number of partners committed to what was called the Presidential Health Compact. And one of the pillars of this Presidential Health Compact articulates our aspirations in terms of partnership and cooperation. And I'll quote from this fourth pillar of this Presidential Health Compact. It says, I quote, "Whilst there are many ad hoc and a variety of engagement mechanisms between the public and private sectors, there is still no formalized and legitimate structure whereby the private sector can voice concerns and align its actions to contribute to addressing the public health sector challenges coherently. This results in duplication, inefficiencies, and lost opportunities to strengthen the health system. The absence of a structured engagement forum also contributes to an ineffective and sometimes circumspect relationship between the public and private sectors. There is a need for a representative and structured stakeholder engagement mechanism between the private sector and the National Health Department and the national role players in the delivery of health services. So this is what was declared at the time of, the Presidential Health Summit and the signing of the Presidential Health Compact. So I believe that the summit which you are holding will also add to some of the observations of the Presidential Health Summit in terms of the various interventions which we need to embark upon to make sure that we can build resilient health systems which can withstand not only this pandemic and make sure that we can emerge out of it stronger, but also make us strong for future pandemics, because we are also well informed that this will not be the last pandemic. There's going to be others, many more. But the more we have strong and resilient health systems buttressed by both the public and the private providers, then we can be able to make sure that we emerge quite victorious under these circumstances. So there is a lot which we can build on from the experiences of the last 2 years of this pandemic, the COVID pandemic. And we believe that with the lessons learned, we can build on this and make sure that indeed we have more resilience going forward. So on that, I want to wish this summit all the success. We're looking forward. I've seen that you have really a very high-powered list of speakers lined up to participate, and quite an array of participants with quite already a big number of confirmed participants, over 1,500. So we are looking forward as a Ministry and Department of Health to the outcomes of this summit, so that we're very optimistic that your conclusions and your observations and your resolutions will contribute a lot towards building a very sustainable and resilient health systems for our country. Thank you very much. I wish you all the best.